Maybe. I wonder if anyone else is having.
Yeah.
Remember the last time, remember the day I started, we were doing this as well, and everybody had difficulty getting in. I know I couldn't get in that time as well.
If it happens again, I think that's the end of WebEx for me.
Okay.
Sinead.
Hi, Sinead.
Where's the registration link? That's on that thing normally, isn't it?
There's people here coming. I'm getting notifications. People accepted registration, so it's still coming in. So people.
Okay.
You can hear me okay and see me okay?
Yeah.
Yes, Sinead. Did you get it sorted?
There's people only
No.
registering now. Imagine there's people only registering now in the last
Okay.
5 minutes. So yeah, I've just accepted those there now. So they're the notifications I'm getting in.
It's like watching the kettle boil, isn't it?
Yeah.
Oh, here we go. Very silent. I know. Hi, everyone that's coming in. We're just going to give it a couple more minutes. Okay, Karina, can you see the chat there?
Yeah.
Just saying, we've had this problem before with WebEx. Is there anything that we can do can we take the password off, or?
No, we cannot post registration as far as I'm aware, no. 1 second now.
I always find it strange that some get on and some don't. So I just wonder what's happening across our networks that happens.
I'll just try this here. Try this. I'm going to post this here. I've just resent the attendee invitation, the register link. It's the register link, so hopefully that might. See, the password is using as well as the password that they've set. It could be the password that they've set up for the account.
Okay.
For their WebEx account.
Oh, okay. So there's
Yeah.
a webinar password. So Brendan, there's the MPN password that's there. So I think, should we just give it a couple more minutes and then we'll get started?
Yeah. Yeah, I'm getting, just.
Okay, but people are getting in, Kavina, so.
Yeah, it's not a universal. If nobody was going to get in, I'd be worried.
Problems.
Yeah.
Yep.
I would also suggest referring to the document I would send out to all the registries if it's troubleshooting guide for the day on the day. So if any of the attendees are listening, I would have sent you all a how-to guide for webinar, joining webinars. So if you refer to that and try some the troubleshooting Q&A on that sheet, it may help you to get on as well.
Should we make a start? Okay, because you're recording anyway, aren't you, Kavina? So for those that are on,
I'll just. Okay.
So anyone that did miss it, they'll be able to get access via our YouTube channel after the event.
Yep. Okay, well, I go ahead and okay. Okay, so good afternoon, everyone, and thank you for joining us for our latest webinar in our series. Today's webinar is hosted by the digital health team here in Community Health, Cavan, Donegal, Leitrim, Monaghan and Sligo. My name is Kavina Pilkington and I'm the digital support within our team, and I'm also delighted to be acting as MC for our webinar today. The aim of our webinar is to showcase digital work across CH CDLMS with the view that this will help inform others who may be thinking about processes in their pathways that they would like to digitalise. We are not here to reinvent the wheel, but we do want to help services and advise on solutions that they can avail of. We've begun to develop a suite of how-to guides that will help signpost you to the place to get information and how to set up a digital solution, including where to go for training. Today, we are focusing on how you and the team you're a part of can enhance and build efficiencies by adopting digital solutions. Just a few points to note from today's webinar. Today's event is being recorded and this recording will be available to view on our YouTube channel, and you will be sent a link to for the recording after the webinar. Please note that the video will only record video of the panelists on screen and not the audience members or our chat feed. For our audience attendees, you will note that your audio and video is turned off. This helps to assist us in managing the online event more smoothly. But if you do have any questions or issues during the event, please post a message in the host to the host in the chat box at the bottom right of the corner of the screen, and we will do our best to respond to your comment or query. So without any further delay, I'm going to hand you over to Aisling Gannon, our General Manager, to commence this afternoon's session.
So thank you very much, Kavina, and thank you very much for organising the event and to the team in supporting. And I suppose I'm just going to say what Kavina has said there. We know that we can digitalise our pathways. We have tools that can enable that. And we're very keen about showcasing and sharing good practice. As a team, we don't confess to know all. So there's some things then in the tools that might be shown today that you might be able to offer some top tips yourself within the webinar, but just wanted to say thank you to you all for taking the time to come and join today. We hope that you take some learnings from it, and if there's any sort of tips for us going forward in the future or anything else that you want to hear about in more detail, if you could let us know at the end. So just to say thanks, and thanks again once again, Kavina, for organising the meeting.
Thanks, Ashton. Now, I just want to remind everyone again that we do welcome comments and queries and questions on any of this afternoon's topics. And as I said, you can post a message in the host to the host in the chat box at the bottom right of the screen, or you can also raise your hand and we can come to you to answer your question if we can. So first up, our first topic for today's webinar is email management. Now, email is an integral part of our daily work, but are we maximizing its capabilities? Many of us might not know that there are small but effective steps we can use in Outlook that can make our working day more efficient. Now, our guest speaker on this topic was available to attend due to unforeseen circumstances. So I'm going to take you through some pointers that can be used in Microsoft Outlook 2016. Now, this is the desktop version of Outlook. Many of you might be using the app version of Outlook, but I'm going to be using the desktop version. So I hope that what I will go through with you now might be of some help. And of course, as always, if people know of other tips or quick wins that they use in their own office or within their own team, please let us know. We're all about gathering knowledge on this team and sharing it if we can. So I'm just going to share my screen here. So guys, if you can let me know if you can see that screen okay. Sinead, Geraldine, can you see that?
Yes, yeah, we can see it.
Okay, great. Okay, so I'm going to quickly just start off with a quick win that we use here in our team is categories. So this is really good if you are manning or operating a shared inbox, as many of you probably are within a team. And this is a good way of time saving and a good way of organizing any emails that come into the inbox, and also to manage correspondence within the team itself and who's doing what in responding to or managing the email. So you just click on whatever email you're processing at the moment, and you right click on it and you go to categorize. And you can see we've a number of categories set up on our email system as it is. So to add a category, you just go to all categories and you create new. You call the category whatever it may be. So it could be to be actioned for response. It could be PQ query or parliamentary question query, anything like that. So I'll just say FAO Kavina, for example. So I know that everything that will have this category assigned to it is for my attention, and you can assign whatever color from the charts that's provided. So I'll just pick yellow and go OK. So you'll see there that the category automatically populates in your list of categories, and then just OK. So you can pick when you're going through your emails, then you just right click, you categorize, and you select whichever category you want to assign to that particular email. So I know that when I go into the inbox, into a shared inbox, or even to my own inbox, that I'll have categories assigned to the individual emails. It'll be customized. So for example, if you're using a shared inbox, it can be assigned to different members of the team, so there's not going to be duplication and people are not going to be wondering if an email has been responded to or who it's been responded to by. So that's one quick win that we use here, and as I said, it does save on time, it saves on communication and confusion as well within a team if you're managing email. Now another
Okay. Sorry, Kavina, to interrupt you there. Just there's a couple of queries coming in or on the emails, just saying that the text is very small. Is there any way you can make it bigger on your
yeah, I'll try this. No, that's on the actual email. I think there's a way of maximizing the screen now, to be honest.
If it's in front of them, you'll see a plus and a minus sign. If they tick on that, they should be able to increase their size.
On their WebEx screen.
On their WebEx
on the top of your WebEx screen, there's a minus and a plus, and you'll see the percentage sign. So if you plus on that, it may help for you. Okay.
Okay, so I'll just continue on. So the next quick little tip as well is a good way of organizing an inbox for an email is to create folders for individual projects or individual correspondence. That's a good way, and it also keeps the actual inbox itself clear and uncluttered. So you can see on my inbox here, I have a number of different folders created based on a particular workflow or line of communication or a project that I'm working on. So a quick way of doing that is just right click on the inbox, go to new folder, and you call the folder whatever you want to do, whatever it is going to be, so what you're going to be storing in it. So I'll just create it as a test here, just as a demo. And then you can click anywhere on the screen and you will see it'll create it in, it'll file it in alphabetical order. So then you'll see it's empty at the moment. So if I want to move emails into the inbox, I can just drag and drop into the particular folder. So in that case, I'm just dragging like that and just drag and drop. So then when you open the folder, then again, goes back to the categorize. I can see that in that folder that there's an email there for my attention. So 2 quick wins. It'll keep your particular inbox organized. It'll help keep your work organized as well, and it'll keep the lines of communication as well will be clear, because you'll see when you go into any individual, for example, if you're using a shared inbox, if you go into the individual folders, you also, if you're using categories, it'll also help you to see who actioned it, when it was actioned, or if it was just an information email. It depends on how you've categorized your emails. So that's just another quick win around Outlook. So another quick and a good way of minimizing traffic around communication and organizing, if you're organizing meetings on a regular basis for multiple team members or even people outside of your team, and there's numerous emails going back and forth about availability and who's available. A great way of minimizing those lines of communication is by using your calendar. Now, your calendar in the Outlook and the desktop version sits here on the bottom left hand of the screen. You can right click on that and it opens it in a new window. So it's not that you can actually open it in a separate window. So it sits separately to your inbox. So you can see there the duplicate. There's my email inbox, and then this is your calendar page. So I can see there's my calendar with all my different appointments in it. So we'll say I want to organize a meeting for myself and my colleague Sinead one day, and rather than calling Sinead or emailing her, giving her a load of different options of times, I can actually go in and look at her calendar. So you go to Home, you go to Open Calendar, and you go to Open Address Book. So this opens the address book that we all have access to through our email. So I just put in Sinead's name here, and I can see that that's Sinead there, and I just click on Calendar and go OK. So there's Sinead's calendar has opened in front. So straight away I can see what dates and time she has free on individual dates. Now, at the moment, I have full access to her calendar because that's how we've set it up as a team. We've given each other access to her calendars, the viewing access. So if you want to even, rather than separately, then you can click on the little arrow on the top of the individual calendar, and then that overlays the 2 calendars or the 3 calendars over each other. So you can see there that we have clashing times within our calendars that we know won't work. or there's times that both of us are free. So when you're sending an invite for a meeting, again, you're going to minimize straight away. You're going to give people times and dates that you know are free, rather than waiting for correspondence back and forth trying to get everyone in agreement. So in order to get calendar permissions as well, you go to Home, and this will highlight your calendar permissions, and then that's how you select what kind of permissions you want to give to the individual people on your team, or if you wanted to even people outside of your team that you know that you're going to be meeting on a regular basis, so that they can see what your actual meetings, what the details on your calendar. So that's calendars. So that's, again, another quick win. Saves time on communication, saves email time, and also saves on the old quota size in the inbox as well. Your inbox doesn't get cluttered with numerous correspondence. Okay, so that's just your calendars. So then also an important thing for all of us to remember as well, because I know we're all challenged with email quota sizes, and of course, email quota increase is on the way when we are fully migrated to Microsoft 365. We will get an increase in our email quota, but at the moment, many of us are tied with this. But an important thing that we all can do is to archive our emails on a regular basis. Now, the emails don't get lost, they don't disappear. That's the important thing to note, but it is a really good way of keeping your inbox clear, organized, and decluttered. So in order to archive your emails, you go to File, and you go to Cleanup Tools, and then you go to Archive. Then you select which one of your folders or even your inbox that you want to archive. And then you also you can select the date from when you want to start archive them for. So we'll say if you want to go back a number of months and archive your emails from April until now, you just select the date that you want to have them archived from. So automatically it has populated in here that it's going to archive mine from the 30th of June. And then this address down here is where it's going to be saved on your desktop or on your computer or your laptop. So this is where all your archive emails are going to sit. It automatically populates this, maps this place on your laptop or your device, but you can also change the location if you want to save it somewhere in particular. If you wanted to save it on your desktop, you can go to desktop or your documents, or if you have a shared folder, if you have your own folder as well, you can select to save it here, and then you select it's the same as saving a document essentially. You also put a name on what you want to save it as. So you can see there, I've already archived some of my emails already, and that's what I've saved them as. And then you just click OK. So once your emails are archived, when you go into your inbox, you'll actually see it sit down here alongside the left-hand bar of your inbox. So there's all the archives that I've created so far for my account. They don't get lost, as I said, they don't get deleted. They sit on your device in the address where you have saved them initially. So that's a really important thing that all of us should be doing anyway on a regular basis. You can save as I said, your inbox, your sent items, your deleted items, you can archive them all. And again, a very important key thing that we should be doing to free up space for when it is at such a precedent. So I think that's just a couple of the quick tips and learnings that we have made as a team, and things that have been working very well for us. And also the key thing is that, like anything else, when you're bringing a process into your team or bringing a new practice into your team, it has to be discussed as with all the team, so that everyone is operating the system in the same way, especially when it comes to things like categories and folders. Everybody has to be in agreement and everybody has to be following the same process in order for it to succeed. And again, you learn as you go on. Some things may not work. You might have to change wordings. You might have to change what you're categorizing or what you're calling folders, but it is a learning process, and nothing is always success straight off. So it's just to practice, I suppose, really, and again, sit down as a team to agree on how you want things to be organized. Okay, so on that note, that's my little presentation for today. I hope people have found it helpful. And again, please do put any comments or questions into the chat box on the bottom of the screen, and do let us know if you've any quick wins that you've developed in your own team as well.
Okay, thanks, Kavina. That was a great presentation. Now, I know for some people, they've said that it's been a bit blurry. Can I just get a sense, maybe if you give thumbs up that it was clear, and maybe thumbs down if it was blurry, because we might get Kavina maybe to re-record that again, maybe, because I had issues with it being blurry earlier as well, and that, but I thought it was my network issue. So, but I know I checked it on the other girls' computers and it was actually clear. So we just want to get a sense of what it was like with everybody, if that's okay. So thumbs up if it was clear and a thumbs down if it was blurry for you. There was 2 or 3 questions that came in, Kavina. There was one, do you have to go through the Avanti process to set up calendar permissions? So if you wouldn't mind demonstrating, could you demonstrate that for us again?
Yeah.
And then the other question was, let me go back on it here. Just go through Avanti. Apologies now. Can you view staff? Can you view the calendar of staff outside your team? And the answer to that is yes, you can. And I know Kavina probably mentioned it after you put up the question. But when you go in to look at somebody's, so if I went in, I think who put up that question, Kira. So Kira, if I went in to look at your calendar now, I can click on your calendar, but all I'll see is busy. All right, or I'll see when you have maybe a vacant slot, but I don't see exactly why you're busy, if that makes sense. But it'll just come up that you're not available, or if you're on leave or that. But it's you don't see anything else. You don't see what exactly the person is doing. So you can. But Kavina did mention that earlier. All right.
Yeah. So I hope you guys can still see my screen there. I'm now on my calendar. Can you see that?
Yes.
Yeah. So when you go into, so I'll just go to, so when you open your calendar looks like this. Essentially, this is your own personal calendar. So then go to calendar permissions. So you go to home, go to calendar permissions. So then you just add a person that you want to give the permissions to. So I would add, like I've added Geraldine Sinead here, and then you select the kind of permissions that you want to give them. So I would add, I'm just going to select, I'll just select Geraldine again for them. And I'm adding Geraldine, and you go, okay. See, I can't, I've already added Geraldine, but that's how you go in and add somebody. You select them from the address book. So you could select somebody from within your own team or within the organization, essentially, and you'll just click OK. And then it'll ask you what kind of permissions you want to give them. So do you want to give them, you'll see here, you might, hopefully you can see that there, you can give them reviewer permission, or you can give them editor permission. So reviewer basically means they can see the details in your, they can go into your calendar and look at the meetings, or you can give them editor, which means you can go in and give them full rights to do everything within your calendar. And then you'll see this is the kind of permissions you're giving them. You're giving them, all they'll see is free busy time or free busy with the subject, or you can select full details. So I'll just go quickly through that again. So you want to add a person, you just add it. It'll bring you into the address book. You select the person you want to add, you click OK. Then you want to select the permission level. So this is the permission level. See if they're an owner, they're publishing, editor, author, reviewer, contributor, or you just want them to see this free busy time, or with the subject and location, or just free busy time. And then you select then also the read details. What kind of, do they have full details? And then you just click OK, and then that gives the person you've selected the permissions for your calendar. And then if you just want to see another person's calendar in the organization, you just go to open calendar, you go to from address book, and you select the person. And then, as Sinead said earlier, that you will just see if they're free or busy, because they probably have restrictions on their calendar. They won't have, everybody doesn't have full access to everybody else's calendar unless they've been granted. So I hope that clarifies it.
Thanks, Kavina. I hope that's clarified it for everybody. And if there's any other questions, we can put them up on the chat box, and then we can always go to them at the end of the session. Anyway, but as I said, if we might get Kavina just maybe to record that session maybe again and put it up as a separate one, and that, because it was blurry for some people, if that's okay, Kavina. But okay, so I think it's,
and I think
over
that's
to me.
again, as I think it is a network issue. I think it's sometimes,
yes.
yeah. So.
Yeah, because it is clear. We were on the same network, myself and the girls in the office, but I couldn't see it clear this morning, so we don't know what it is.
Okay.
So I think it's
okay. That's great. So so now on to our next item. So MS Planner is a digital tool that simplifies task management. Now it's easy to use and can be shared with numerous team members. We've adopted it here in the digital health team in the last few months, and it is now the main communication tool for us. It can be accessed with your HSE email and password, and I'm joined now by Geraldine Snee, our colleague here in the team, and Sinead to give you a demonstration of the tool and its functionality. So over to you, ladies.
Thanks, guys. I'm just going to share this with you. So, Kavina, will you let me know when you can see my screen?
It's starting to share now. Yeah, we can see it.
Perfect. So can you see that full screen there?
Yes, we can. Yeah.
Perfect. So, so guys, my name is Sinead Malloy and I work on the digital team, and I'm just going to give you a brief overview of Microsoft Planner. And as Kavina said, I started in this job in February of this year. And in my previous role, as a diabetes nurse, as clinical nurse specialist, I didn't use this tool. I didn't know we had this tool and that it was available. And I think if I had actually used it in my previous role, I definitely would have been an awful lot more efficient. It would have saved on multiple emails going over and back, or been able to follow up on stuff with my colleagues within the team. So it's definitely kind of transformed the way I work since I've come into this office. And it's great for people, say if people are on a day off, you're able to see exactly what's going on with a task and where it's at, and if there's any updates on it. So it's called Microsoft Planner. So tell me when can you see that it's gone to the next screen, Kavina?
Not yet. It's just taking a minute to load.
Yeah. No, it's just gone back here now. Sorry. So you can see screen 2, yes?
Yep.
Okay, so as Kavina said, Microsoft Planner is a tool that provides an easy to use overview of the tasks that need to be completed. And it's in an all-in-one dashboard, and it can be shared with all your team members. Okay, so as I said, in this demonstration, I'm just going to show you how you can get it. And so if you go to your address bar, okay, and you can type in the link there to how to get the https://task.office.com, and that's how you can actually you can bring it up and you can download it that way. All right, and then it'll ask you then to sign in using your HSE email and your HSE password. So just make sure you know your HSE password for your email, because that's what they'll ask. Alternatively, it may be on your computer already, and maybe you weren't aware of it. And if you go to the search bar down at the bottom of your screen, you know where you've got the search icon, and if you click in there Microsoft Planner, again you can open it from there, and it'll ask you to put in your HSE email and your HSE password. So when you do that and you get logged into it, you'll get something like this. You'll get into a page which is similar to this. Okay. So this is a photo of what the page looks like. Now we have a couple of them set up there already. So disregard. Can you see that blue icon going around on the screen, Kavina?
Yep.
Yeah. So where we've got these set up already, don't mind them. Okay. This will be completely blank for you. All right. So the first thing that you do is you click on a new plan. Okay. So just there where the arrow is pointing. So click on a new plan. Then when you've got your plan and you've got your plan name, all right, okay, you can set it up and customize it to your needs. So we have 3 titles on this particular plan, and it's called Not Started, In Progress, or Completed. And these are called buckets, all right, okay, these particular tasks here, they're called buckets. So again, as I said, we've got 3 set up there. You can customize them. You don't have to call them Not Started. You may have 7 stages in a process, all right, and you might say stage 1, stage 2, stage 3, and so forth, and you can customize it as you wish, all right. So these tasks you create buckets for the tasks, okay. Up on the top of the screen, you can see there Ashlyn's name is there, okay. You create your team members. So you can invite your members of your team here, all right, okay. And then when you click on this icon here, you'll be able to see who are the members of your team, all right. So then when you go and further on, when I'll show you the example, when you go on further on and you've created a task, you can assign your different team members to particular tasks. You don't automatically assign all your team to the tasks, okay. So when you have created the task, you press the Add Task button. All right. So when you click on that button, so when you do, all right, okay, you'll get this a little pop-up which looks like this. So then you can title it, all right. So for the purposes of this demonstration, we've created this scope e-referral software. Okay, so that's the title of our task, and it's what's called in a work stream called in this ECC work stream, because this is what we have set up. Okay, so scope e-referral software is the task name. All right. I then want to assign an owner to that task. So if I click on the assign button, any members of my team up here, I can assign them to it. All right. And then you go and you press the green bar and go add task. All right. So when you do that, it'll bring you to the next page, and it'll make it look smaller. All right. Okay. So you have to actually kind of double click on it to get into the task. Double click on your referral software. You'll get a page like this. All right. So again, you can see it. You can change the title of it up here if you want. You're also able to see their last change by, and the person that changed the task last will come up there if it was 2 days ago or 3 days ago. Again, I've shown you already where you assign the member to it. You can also create labels. All right. We use these labels within our team. So we have a set of customized labels that we use. So say if it's something, a request that comes into the digital team and it's from mental health, we can assign those 3 labels. So we can assign the word request, mental health, and the digital health team. Or if it's an all-encompassing request about ECC, we can assign an ECC label. So we're able to, because you're able to export, I suppose, reports from the Microsoft Office into Excel, it actually will be able to allow us in time to filter the amount of requests we're getting in from different services. But again, you customize these for your needs. So then you'll also see what the bucket, all right, and if it's started or not, and you click down the icon, it'll say in progress or not, and then you click the progress button if it's in progress, and then you can prioritize it. Okay, you can decide if it's medium or high risk or low. All right, you can click on your start date, and that can be any time. All right, and then you can put in a due date if you wish. All right, and just if you do put in a due date, you will get reminders via your email if a task is overdue. So how we would use this, so let's just hypothetically pretend I got an email in about e-referral and it's the first one I've got in. I would actually copy that email that I get and put it into my notes here. So that is the starting of the task. Okay, so let's just say a service wants to set up an e-referral. I would copy it into my notes here, and that stays, that doesn't change. Okay, so that's the summary of the task. So when you've got the summary up here, and then you've got the next part of you've got a checklist. Now this automatically is empty, but you can create a checklist. So again, for the creating an e-referral, we might say on our checklist, we've identified the software currently used, meet with the service, review the software, and engage with a vendor. There are 4 tasks we need to complete. All right. And again, you can click on those tasks once they're done, and a line will go through them. So you will be able to see at a glance another team member if that has been completed. if you wish to add documents about the particular task, whether it be an Excel document or a Word document, you can actually add in the attachment here on this part. So when you click on add attachment, it'll come up there saying from your computer or from a URL or from a shared file, and you can actually just click on those there and add it directly into your planner. Then down the next part then is called comments on that. So again, anything in related to the task. So say if Kavina had done the scoping and wanted to write a little note about what she had done, she would write that in here in the comments bar, whatever she has done, okay? And there's a send button underneath, you can't see it there, and it sends, but it's automatically, you can see every time there's a comment put in, you'll see it on the bottom of the screen there, all right? So if Geraldine then got in 2 days' time gets an email in about another place looking for or e-referral or a query about that e-referral that we're trying to set up, you can put it in there. All right. So it's quite intuitive really in how to use it on that, and it's great. It's great to be able to see exactly where you are in a task. All right. So this is just giving you a demonstration. So again, as for the purposes of this demonstration, we had put in 3 ways. We had not started, in progress, or completed. So if you wanted to move something from the not started bucket into the in progress bucket, you can just drag and drop it across, okay, or click and move it across, all right, quite easily. So there's just a demonstration of it there. And once you have created a task, all right, okay, you can then pin it to your taskbar. So you can see there, you can just click on it, all right, and you can pin it so you're able to see at a glance how many tasks you have open, how many tasks you have in progress, how many tasks are late if you've put a due date on them, and how many tasks are complete. And they will come up, any work streams that you've generated will come up here along the side, and it's quite easy to use, and it's great to be able to see how a task is actually progressing. So the way we have done it in our service, that we've added the planner to our taskbar, all right, so it's easy to access when you need, and I've also pinned it to my taskbar below as well. So it's once you have it, you don't have to go back into your desktop to get access to planner. You can actually pin it to your favorites or pin it to your taskbar below on your screen below. This is just some useful information. We have, there's a copy of this presentation that I've demonstrated there to you on our catalogue, and that, so you'll be able to view it. And then also Microsoft Planner support, there's a link there, a hyperlink, and it's got great resources there on how to use the planner as well. Just kind of further expanding on what I have said to you. Okay, so I think that's me done. If there's any questions, I think there might have been 1 or 2 coming in there. Sorry, Kavina, we can't hear you. You're on mute.
Excuse me, sorry. Kira was just asking, can the attached documents within a task be linked to a shared drive, and will it update the shared drive if it's amended?
It won't update the shared folder. All right. So if you amend it, if you open it up through the tasks, okay, on Planner, all right, it's a live document, all right, so it'll automatically stay updated within the Planner. But if you want to are going saving that to a shared folder, all right, okay, you'll need to save it there as well, all right. You need to save it in 2 places. It doesn't automatically update it to the shared folder. So I suppose that's a process you need to identify as your team when you're going in to a document. Do you access it via Planner, or do you access it via a shared folder? Because if it's a shared folder, you need to make sure that it's updated. So that's just something you need to decide as a team. We always kind of keep a backup in our shared folder as well.
Yeah, and again, yeah, that's as well. It's again reiterating, we started using the planner tool when we first came together as a team back in January, and it has had a couple of different incarnations in that time before we got it down pat, how we got our processes and how we were going to use this down pat. We had to tweak things, change things, some things just didn't work. but we have it now in such, we use it in such a way that we're all on the one page, so we're all know exactly how it's supposed to work. And the other important thing is that we all keep it up to date. We know that this is the same, doing the planner update, checking the planner is the same thing as coming in and checking your email. It's that automatic for us now. So it just becomes part of your day-to-day process. So that's another key thing to, I suppose, message to drive home. Everybody has to buy into it, and everybody needs to sit down and have a discussion on how they want to work. And then as well, that you have to realize as well that it won't work perfectly the first time you start using it, or even the second time you start using it. It does take a few different incarnations for it to really work for you and your team. So I think there's just one more question there.
Is there another one there?
Oh yeah, I think that the Kira's question kind of addresses what you were just what Brendan has asked there. If you have a file in the shared folder and you update that file, will the uploaded version appear in Planner?
No, the answer is no. You need to save it back into Planner. You can delete the old version. So I hope that's clear. Okay, but it's like Kavina said, and it's the same with the Outlook. I mean, we've tried it, we tested it, we failed. All right, okay, it didn't work for us, and we went back and we kept getting it right until we feel that we have it working to our best ability. And like it definitely with Planner, when I started, I think I was learning so much. I suppose I probably wasn't using Planner and that, but it just took, you know, us all saying, right, it has to be on Planner. You know what I mean? If it's not on Planner, it's not done. And it's just a great way of keeping on top of things and I think we do have it, but down to the way we want it to work, but we are constantly reassessing. Look at, is there a better way we can do this? Is everybody singing off the same hymn sheet?
Okay, great. Thanks, Sinead. Thanks for that. So as we move towards more digital approach to our workflows and processes. Oh, sorry.
I think Geraldine is going to give her
example. Oh
example.
yeah, sorry, Geraldine. Apologies. Yeah, sorry.
Don't worry.
Apologies, Geraldine. Yeah, go ahead.
You're flying on ahead. You're against the clock, Kavina.
Sorry.
That's all right. No, it's grand. I was just going to say hi, good afternoon, everybody. From my perspective of using Planner, it's just prior to me joining the digital health team, I'd never used Planner. I didn't even know it existed. But using Planner has changed the way I work. It certainly is one of the items I wouldn't do without now. In my previous role, if I had a query, and if I had no way of finding out, I'd have to ring around, email, or wait for somebody to come back into the office for me to be able to answer a query. With Planner, there's none of this. For example, if one of my colleagues is out of the office or if somebody inquires about an action or something about a plan that's on it, all I have to do is go in and check and see the answer there and then and give the answer to the person instead of having to go around with numerous calls and emails. Don't get me wrong, like when I did start using planners, like as Kavina and Ashton said, and Sinead said, it was daunting. I was making mistakes, but you do learn from them and you move on. In Planner, you can also create plans and create buckets. On each plan, you can either give it a name. Now, for example, for us, we've used, say, first actions for the team. We can use office management, whatever you wish to use, whatever names you want to give. And in that, as Sinead was saying, you can put them down as in progress, to do, or completed. And then the names can be decided within your own department. You can assign a tasks to yourself or to members of your team who you have added to the plan. When the emails come into our general email, they are put up into the first actions, and at our weekly meeting, they are assigned to the different members of the team. Tags is also another important item and part that we put in with our plans. Tags are assigned in the way we have broken them down is we've decided to go with area, department, and the reason for referral. And all information relating to the individual task is recorded into that comments box. And the comments box, once they are updated, you get an email through to say they've come through. Once an action has completed, you move it over into the completed action and completed bucket. If you wish to do KPIs, you can do so by pulling them from an Excel spreadsheet and running your KPIs on it. I think that's me done. I'm going to pass it back over to Kavina.
Okay, thanks, Geraldine. Yeah, so that's an important note there at the end that Geraldine it's another great way of for KPIs for a team, because you can export all of the information from the individual plans into an Excel sheet, and it will pull everything in there. So it's a good way of building, and it does create a dashboard for you as well. It's called the Hub on it, and you can see the progress of each of the individual plans as well. So that's a really good function for it as well. Now I see there are some more questions coming in on the planner, and I'll actually go back to them at our Q&A session at the end. So we're not ignoring you, but we will come back. Okay, so as I said earlier, we're moving towards a more digital approach to our workflows and processes. But one of the key challenges to this is the culture that exists, and how do we go about changing it? Ciara Moran is an advanced nurse practitioner who has recently joined the ICPOP team here in CH CDLMS. Ciara has just moved from the UK, where she worked in the acute hospital sector. She was at the forefront of that service's move to a fully electronic health record. Now she shares her learnings with us from what was a massive change to the service and the staff working on it.
Hi, my name is Ciara Moran, and I am currently working with the Sligo Leitrim ICTOP team, which is the integrated care for older people, and I'm a nurse practitioner working with that team. Prior to this, I lived and worked in London at University College Hospital up until April of 2022 before I moved to Sligo. There I trained to be a staff nurse and progressed, did my master's and became what they call over there an advanced clinical practitioner. I initially worked on the acute medical unit, which was a 56-bedded unit that had 30 cardiac monitors, and then worked there for a few years before transferring down to the emergency department, where still worked with the medical team, but as a trainee and qualified then advanced clinical practitioner. The reason why I've been asked to give this talk is to give my insight on how we went fully electronic. So University College Hospital in London went fully electronic in 2019. It was 2 years from the time the business case went in to when it actually went live. So there was a lot of work going on in the background before it actually happened. And yeah, so like in 2019, I do remember I was a senior staff nurse at that point, and so there was lots of training involved prior to it going live, but it was like, you know, it was this massive date in the diary, and lots of people, there was lots of apprehensiveness before it, and lots of training that went in before it, and how it was going to work, and all the conversations that go around these things. But overall, in the initial stages, don't get me wrong, you know, nothing is ever smooth sailing, is it, in healthcare? But and when you do something this big, it's a lot to take on. But in the early stages, everyone got a basic training. I guess a lot of the clerical staff and the admin staff, they actually got trained first, because they were kind of like the gatekeepers to the Epic software that we used. So they were the ones who kind of started the ball rolling, and then the clinical staff came on after that. And we had what we called over there as super users. So you'd identify somebody within your department who worked there all the time who would become a super user, and they would then go and have additional training surrounding, you know, how to use the systems. Everybody in the whole department would get some basic training, and then after that it kind of went from there. In the early stages, I suppose it was a matter of, you know, teething out some of the issues, because this was a software that was built up by IT people, and it was getting it to work for us. That being said, having a fully electronic system made our lives so much better. You know, it, from every aspect, from a patient's perspective and from a staff perspective, it was just easier to do your job, to make referrals, whether it was giving medication, whether it was documenting care plans, all of those things were much easier from an electronic when you compare it to paper documents. And having come to the HSE and initially worked in the emergency department in Sligo for a few months and seeing kind of how things are there, and then transferring into the role that I have with the ICTOP team, I can fully appreciate that having a fully electronic system is not only better for the staff, but for the patients. And I fully support the progression to the HSE evolving and to having these systems. Hi, my name is Kira.
Sorry guys. Sorry, it's just... Sorry.
Okay,
So, yeah, that's fine. Yeah, sorry. Just started to replay. Sorry about that. So that was Kira's experience of going paperless and going to a fully electronic health record from her, and now going from that into our service here in the HSC. So Sinead, you had some observations there and some things you wanted to share about the future of electronic health record.
Yeah, just I suppose we're a long way off a national electronic health record. We're probably definitely a couple of years away. I suppose all eyes are probably on the new Children's Hospital that's going to be all digital. And they've just recently procured the same software actually that Kira talked about in the UK called Epic. And I know listening to conversations about that, I mean, it's at least a 2.5 year plan for them to go live in the new Children's Hospital. So I suppose we don't. Well, I'd love to think that we're getting closer to electronic record here. I suppose across the CHO. I suppose it's not going to happen in the near future. And so that's why I suppose we've planned and shown you these digital tools. I suppose we can't do everything. They're not all connected to each other. But I think we have to make the best of what we've got at the minute and to try and use them to their best capabilities. And I suppose, as Kira has said, like it's about the patient, and the patient should be central to all this. And if an electronic health record improves the patient experience and the patient journey and improving the times of access to clinicians, it's going to be of huge benefit. But as I said, I wish it was sooner. But I know people have an interest in the electronic health record and where we're at with it. But unfortunately, nationally, we are a couple of years away, unfortunately.
Okay, thanks, Sinead. So just that we've also the digital health team here have facilitated a number of design workshops over the past few months, and some of the attendees today might have been at those. And one of the recurring themes that have come up in those workshops was the issue of document management, and I see it coming up even in the questions today, and the challenges that poses for a team. So Sinead is actually going to take us through just an overview of some of the solutions that are available to staff to manage this issue. So over to you, Sinead.
Just bear with me now. So you let me know when you can see it, Kavina.
Yeah, all going good. Yeah, perfect.
Okay. So Kavina and I have just prepared, it's like a one-pager, all right, okay, about the document management solutions that we know that are available within the HSC currently. Now, there may be more but these are the ones that we're aware of and that people are using within the organisation here locally. So I'm sure most of you on this call know of shared folders and you can get your shared folder set up on Avanti and you could get it mapped to your device, and you can add people to a shared folder. So the shared folders obviously enables you to share documents with each other and others within your team, and you're given access to, and it can be used for both patient and personal data, and you request for the shared folder set up through Avanti. Okay. So the next thing, so shared folder, share file, SharePoint, all sound very similar and that. And I think, again, when I started in this role, I got a little bit confused with them all. Even I would have known shared folders, but what's the difference between share file and SharePoint? So share file, you can get access through this, you can request access through this through Avanti, and it has to be approved by your line manager for access to share file. But this particular document management system enables you to share, securely share files with people outside the organization, okay, or receive files, and especially large files, because it has quite a large memory capacity. So you can share files or receive files from outside the organization. And it can be used to share patient data. And I know Kavina gave me an example of it earlier, where they would have used it, I think, for the vaccination centre for getting lists of people who required vaccinations, and that would have come through encrypted on the share file. And then the other one is SharePoint. And on SharePoint, it's connected, it's part of the Microsoft 365 suite of tools. And again, when I mentioned earlier, when you're on Microsoft Planner and you save in a document into Microsoft Planner, it makes that document live, and that's through in the back end of SharePoint is what it's using in the background. So again, SharePoint, you may have access to it, and you probably access it in a similar way to how you go down to the search bar on the bottom of your screen, or you type it in if you Google it, okay, and then you may access it then using your HC email and a login as well, and your password. So you can create sites to share documents and information with your colleagues on SharePoint. Again, it's something that we've started to do here within our department, creating our own SharePoint site, and we've gone through several iterations of it, and that just like a one-stop shop for our own team, for our own information, okay, not for sharing externally, and that's just like a one-stop shop for all our documents. It cannot be used for patient data, and staff need to be on Health IRL email, all right, to get access to it, all right, you need to be on your Health IRL email, all right. Another document management systems that's in use, and I know there's an example of it in use in HR, and it's something that we're exploring, I suppose, for use in the the new chronic disease hubs or across ECC, and we've been doing a little bit of scoping on it. And it's called Therefore, and it's a secure document management solution that makes storage and retrieval of files very simple. So again, you work with the company and you set up filters of how you want to access a file, whether it be name or whether it be, like I say, for patient data, if it was a PCN number, and you work with them to customize it to suit your needs, okay. And you also can set up different access rights to certain information, so read only or editable rights, okay. So it's based on a folders and category structure, and it can be used for patient data, but it does come at a cost, all right. We have if anybody is interested in Therefore and exploring it part of your team, if you just drop an email into the digital health email, and we will be able then to send you on some information and contacts who you need to contact to set it up, but it does come at a cost. Whereas ShareFile and SharePoint, they don't have a cost. You can just get them through Avanti or through your email, but Therefore does, and shared folders don't have a cost either. Okay, that's just a brief overview. I hope that it makes it clearer for people. I don't know if you have anything to add there, Kavina or Geraldine, on any of those.
Yeah, just around ShareFile as well. So when you're using ShareFile, it does operate. You can create folders within the ShareFile, almost like the shared folder. You can create subfolders within your ShareFile profile, and then that's where you can share access to the particular folders with particular people if you want. Or a person doesn't even have to be, they can be externally from the like as we were saying earlier, they can send documents or videos or whatever it is through ShareFile, and you'll get a notification. You'll be sent an email notification to say that somebody has dropped in a file or information into your ShareFile account. So you will get notifications on it as well. So it's not like that you'd have to be constantly going in and checking in to see if things are there, because you will be notified when information is uploaded to it. Okay, so thanks, Sinead. Thanks for that. So I'm going to open the floor to questions, comments, queries for anyone that wants it. So a couple of questions that have come there. Can people
Example of KPIs, is it?
Yes, yeah. So maybe if you bring up, will we bring up the dashboard there? Will I bring up the dashboard?
Well, I suppose, well, I can bring it up there. I can bring it up, Kevin, if you want to keep chatting there.
Okay, so yeah, so yes, so Sinead's going to bring up your dashboard. So basically, Planner will create, it automatically just creates a dashboard for you. So you'll see the progress of all the different plans that you have within your planner, and then there's you export the file, so then you can whittle it down. It's in an Excel file that all the information is downloaded to, so then you can create your reports from that using the functionality of Excel to create tables or pie charts or whatever it is, and then the same way as you would have done with any other Excel report, as well as having the dashboard functionality of the planner as well.
I'm just going to share it there. All right.
Okay.
Okay. So this is just an example of our planner. Okay. So if we want to create a report, say, of our first actions, okay, so export plan to Excel. Now, it will probably take a couple of minutes to generate that report, all right? But I suppose it tells us, like, see, you can see there on our screen that we've got completed 278 tasks, all right, okay? So you will have to do probably some cleaning up on tasks. I'm just going to stop sharing that one now, okay? But apologies, next, once I open it up on Excel, so you can see there straight away it's created for me, an Excel document. All right, okay. So again, you can filter. There will be a bit of data cleaning on it. All right, okay. So you can decide then what you want to do with who's the responsible owner for it. You can create what labels are attached to it, and you can filter it down. So there's lots of various ways. I mean, our KPIs are we're assessing, I suppose, how many tasks have we completed, how many tasks have I completed, how many tasks has Kavina completed, Geraldine, and that, and to make sure, I suppose, that's the kind of stuff that we're capturing on this, and that. But you may be setting up, depending on the way you set up your buckets, the KPIs you want to capture. But it does definitely, you do have to do a bit of cleaning on it, all right, when you get it.
Okay, so then we have another question there. The planner, there's a team that are starting to use the planner, and they're finding that it's duplicating with the calendar. Can planner and calendar link?
Not that I'm aware of.
No.
Not that I'm. No, they don't.
No.
And I don't really understand what they mean by it.
I would say that they're probably putting information in the calendars similar to what they're putting into the planner. So they probably see, if you start using the planner, maybe a way of around that was like you just use the planner as the place, as the source of your information, and then just top line stuff in calendars. So then you're not maybe that might be a way of around it. But if you're putting the same information in both the calendar and the planner, there's no way of syncing those up. They're not joined, so there will be duplication. So then it's a decision. Well, do we just primarily, which one are we going to use? Yeah, that would be my suggestion around that. Then
about the completed tasks, wasn't it?
Yeah, so that was, yeah, it'll stay there. Your completed tasks will stay there. They'll stay in that bucket or that folder, in the completed folder.
And you can move it back. Yeah, and you can move it back if you need to. So say if you'd completed a task and then in a month's time you got a query in on it again, or you needed to reopen it, you can reopen the task and just bring it back into an in progress or whatever it is, stage 2 or stage 3, if that's what you're going to call your tasks, your buckets, and that. So it's quite easily done. And just going to the next question there. Can people who don't have HS email use share file, example GPs? Yes, you can share with,
they don't have to, like a person with a non-HSE email address can upload. What you can do is, if you can send a link, you go into your share file, and then you can send the person a link to the share file and they can use that link to upload the information. For example, sorry, Sinead.
No, go ahead, Kavina.
So for example, Kira, who did our presentation earlier, she used her personal email to send the video to me through on ShareFile, and she didn't have a ShareFile account.
And
because I had sent her a link to where to upload it to.
And also, if the GP uploads something onto ShareFile, they don't see everything that's in your ShareFile. You might have multiple documents from multiple people that you don't want everybody to see. They will only see what they've been requested to share with you. So so it's quite a safe way, really.
Okay, so Brendan has a question there about the planner as well. Can you create different plans for different teams and limit who has access to each plan? Yes, you can.
Yes.
That's a key functionality when you're setting up the plan. You add the members to that plan. So, and only those people will get alerts or will be able to add or be able to delete anything off the plan. Yeah, so it's assigned, that's kind of step one when you're creating plan. You've created, and then you add the members, and it's based on your HSE email address. That's how you're adding the members to an individual plan.
Yeah. So for example, Brendan, you could add me to a plan. All right, okay. But all I would be able to see is do edits on that particular plan. I wouldn't see any of the rest of the plans that you have. But you can add, you don't have to have people from your team. You can add external HSE people to the plans as well. Isn't that right?
Yeah. Yeah, you can. Yeah. And so then another around the planner as well. Now, I'm not going to get, it has functionality as well to link up with Microsoft Teams, but I think we may at a later stage do something a bit more advanced on that, because we don't want to overload people. But there is, there is additional functionality to join the planner with Teams. And working around that as well. So that's probably a little bit, we won't go too far ahead of ourselves but just to bear that in mind as well. And then obviously, as when we're fully migrated to Health IRL, and then we're given to Microsoft 365, the functionality of Planner and the access to the apps within that will increase as well as we go on. So it's probably a good way to get in now, get in early, get used to it, and then when you'll become more confident then with the additional functionalities that will come on board as we go along. So that's that. And then we would also mention that, when we were doing about email earlier, now it was very kind of overview, very basic few tips that we did there, but there's excellent training and support from eHealth. So it's ehealth.ie. And they also provide training on Outlook and on Microsoft Teams. They provide it about once or twice a month, but if you want to go onto the eHealth website, there's some great training there, and a real, basically starting from the basics. You don't need to be a competent or a confident user in any of the applications, because it is really a step-by-step process. And then also don't forget about HSE Land. There is huge amount of support there and training on HSE Land as well, around Excel, Outlook, Teams as well, so that you can take the time out. And the thing about that is you don't have to be live, you don't have to be present. You can do that at any stage, even if you had, like, if any of us have a quiet half an hour in a day, some time to take that. And then the good thing about that is you can always go back and watch them as well. The eHealth training, you can always go back and watch them at a later stage. You don't have to be actually present on the day as well. But they are really good and really straightforward, and haven't done it myself as well. I found it very helpful as well, and it's a good way to refresh your knowledge. And as well, if it may be something you've gone back to that you haven't done for a while, it's a really good refresher as well. So
can I just want to, just before we finish up, I suppose, I just wanted to tell people about, there's a digital survey that's going on at the minute. Some of you have probably had it into your emails. So we're doing a digital survey in CH01 and across other CHOs, looking at digital skills and that. And actually CH01 are actually ahead of all the other CHOs, not that I'm competitive, but it's great. So we'd like to keep that momentum going, and that there has, while there's questions about digital skills skills, there's also questions in there about health and well-being, about a staff app. So if you haven't completed the survey, I'd encourage you to do so, because I suppose we want to be able to go back with the hard evidence to people, and that when we're looking for supports for digital skills, because we know there are people out there that we work with that have poor digital skills, and we want to be able to address those needs, but we need the evidence. I suppose an area of the digital survey is just not reaching people maybe that don't have HSE emails. So like your non-clinical staff, like your multitask attendants, your household, anybody's kind of involved in maintenance. So if you know anybody in those roles, please encourage them to fill up the survey as well, because it's those people that we really are trying to engage on that, because we know we need to be able to provide extra training and stuff for people. So I'm going to just share it with you. There's a QR code on it, and that I'm just going to share it and just bring it up here. Sorry, now it's just left me. Of course, it won't share when I want it to. Apologies. There we go. So can you all see that?
Yes, yeah, I can see it.
Yes, okay. Kavina will also maybe just send this as well in the follow-up email with the link to the video. Is that okay, Kavina?
Yeah, no problem, yeah.
Perfect. So you can hyperlink, click on the link to the survey, or you can scan the QR code. All right. So it's finishing on the 26th of October. So thanks a million for all your help with that as well.
Okay, and just don't forget the carrot. There's a
the carrot is, sorry. There's a one for all voucher, and that's anybody that takes part in the survey and wishes to leave their email address. It's not mandatory. Wishes to leave their email address and their contact details, they'll be put into a draw for a one for all gift voucher. So so yeah, for €500. It'd be nice coming up to Christmas.
Okay, so then there's just one more question there around share file. There's a question there: if a company drops a information into a folder, do you get alerted every time they put in information into the folder?
As far as I know, you do, yeah.
Yeah, if you've
an email, you get an alert. Yeah.
Yeah,
so
because you're the one. Yeah, and you've sent the link to them
to them,
for them to use. Then every time they're using it, then they've put stuff in. Yes, you should get an alert.
Yeah, and to keep all your invoices in one place as well.
Yes,
and that if you're giving them the same link to an invoice folder.
Yeah, and then so there's just a comment there: electronic facilities are great, but what about times they cannot be accessed? Network issues, cyber attack, etc. Well, I think that's I don't think we can. I don't think there's
can't mitigate. Yeah, can't mitigate against them. I suppose cyber attack taught us lots of lessons. I suppose, I mean, as a clinical person, while cyber attack was going on, I suppose we reverted back to pen and paper on that. But I suppose while you can't access them, network issues, I suppose we can't, as a digital team, we can't do anything about that. That's back, I suppose, to the people on the ground. But if people are experiencing network issues, make sure that they're being logged on that. So but I suppose, yeah, for cyber attack issues, I suppose we've got better in our preparation for cyber attacks, but cyber attacks are still happening in small pockets, and that with various systems at local levels and stuff. So I suppose it's always going to be a threat. So it is always going to be a threat. So yeah, so I was just thinking about it. What you would do in the event of that happening again, but I don't have any quick fix, unfortunately, to safeguard against it.
Okay, so I think that's all of the comments and questions addressed. I think that's everything. If there's no other business, I will take this opportunity to thank you all for attending today's webinar. And I just wanted to remind you that the recording of today's webinar will be available to watch back for all of those who registered, and they will be issued a link after today's event. So I know there were some connecting issues for some people who are registered, but they will receive a link to the recording afterwards so they can catch up on it. And so on behalf of the Digital Health team, again, I'd like to thank everybody who has taken the time out of their busy days, busy schedules to join us for today's webinar, and we hope to see you all again soon, and have a great afternoon.
Thank you.
Thank
Take
you.
care. Bye-bye.
Bye-bye.